Headache is a common problem that affects almost everyone at different times in their lives. It is a pain that affects the head or the face. It can feel like pressure, it can be throbbing, or you can have a constant ache or sharp pain over the scalp. Usually, a headache can be primary or it can be secondary. When you talk about primary headache, the headache is the main problem, and usually primary headaches form 98% of all the headaches. Then they can be classified as tension headaches, which forms about 60 to 80% of the headache. We have migraine headaches, which forms about 15% of the headache. We have cluster headaches, which form about 1% of the headache. The commonest triggers of headaches include inadequate sleep, caffeine withdrawal, you can have low blood sugar, you can have inadequate fluids in the body due to either various losses or inadequate intake. You can have various forms of stress, either from work or emotional stress. You can have anxiety. You can have difficulties with vision. You can also have a headache as a secondary problem. Usually the commonest secondary headache is a headache that occurs because of an underlying illness, which could be infections in the sinuses like sinusitis. You can have upper respiratory infections or any other infections in the body. And you can also have headaches because there is an underlying problem in the brain, like you have a space occupying lesion in the head. You can have infections of the brain like meningitis. You can have cardiovascular complications like an intracranial bleed, which can cause you to have headache. So primary headache, we will start with tension headache, which you have a bad pressure around the head, usually around the forehead, and it can go up to the occipital region of the head. Usually it is triggered by stress. It can be episodic or it can be chronic. Episodic, usually the headache comes and goes and it does not stay for more than 4 hours. And the treatment may include hydration, exercises, ensuring adequate sleep, and also over-the-counter drug can help to clear episodic headache. Then you have the chronic type of tension headache, which may require long-term treatment with the tricyclic antidepressants, and also sometimes behavioral management of the triggers for the headache. Then usually we also have migraine headache as another form of primary headache. This can be moderate or severe, and it is often unilateral, and it's usually accompanied by a nausea. A nausea is a symptom that you feel before the headache starts, and this could be abnormal vision or abnormal feeling, and can also be accompanied with nausea and vomiting. It can also be episodic or chronic. The episodic, the management is with the over-the-counter non-steroidal anti-inflammatory drugs like Brufen, indomethacin, or the normal paracetamol with caffeine. Or if it's chronic, then you can have tryptophans, which is a class of drugs that are used to treat this type of headache. You can also use some of the anticonvulsants like carbamazepine, and you can also use beta blockers. Cluster headaches is a form of headache that is usually unilateral, happens around the region of the eye, and it can be accompanied with reddening of the eye, and also can sometimes be accompanied with the running of the nose. The treatment sometimes could be with the tryptophans or with the oxygen therapy. For the secondary headaches, it's usually very important to distinguish them because they can be a sign or a symptom of an underlying disease condition. The red flags include the presence of a thunderclamp headache. This is a headache that someone complains that is the worst headache of their life. You can have a new onset headache or a headache that is accompanied with the increasing and deteriorating symptoms. A headache that is accompanied with other symptoms like fever, vomiting, hotness of the body, and also headaches that are accompanied by neurological symptoms. You also can have a headache that is setting in above the age of 50. Then you need to be worried about it, because it could be a sign of a possible intracranial growth, a growth in the head, or it could be a sign of a cardiovascular problem in the brain, like a bleed in the head, like either subdural, which is a bleed just below the covering of the brain, or it could be a subarachnoid hemorrhage, which is a bleed inside the space between the covering and the brain. So for the common remedies of the primary headaches, the commonest ones include lifestyle, ensuring you have adequate sleep, managing stress like work by taking simple breaks in between the work. If you have you are using a screen, taking breaks off the screen to help the stress. And also if you have a vision problem, then having your vision checked and having your vision corrected. Of course, adequate hydration, management of the environment, like if you're working in very hot environment or the extremes of temperature, then ensuring that you have the right clothing, and also you have adequate hydration, noise management in the environment, and in excesses of temperature. And of course, for the danger signs, it's always good to seek attention from your health provider. Thank you very much.